Namibia ranks amongst the countries with the highest HIV infection rates in the world. The northern region, Ohangwena, is one of the most severely affected regions, with more than 22% of the population living with HIV. Young people are particularly affected. More than 40% of all new HIV infections in 2012 were among young people aged between 15 and 24. These numbers are alarming, so we must act today. This documentary is about the challenges young people are facing regarding a healthy, varied and self-determined lifestyle. We will also highlight what can be done to improve this situation.
We have some kind of partnership with the Ministry of Youth through Napa Clinic. The Ministry of Youth has got a clinic that does provide sexual reproductive health in Enana. And basically what we've been doing is to support that clinic in terms of commodities like medicines and clinical supplies. We do fully support that clinic. We also provide technical expertise in terms of training or refreshing, but that is basically that's about it, and we feel it's not enough. There's room to improve on our cooperation between us, the Ministry of Health, and the Ministry of Youth.
Most young people only make use of health services if they are severely sick, and then it's often too late. Young men particularly do not feel responsible and are not involved when it comes to sexuality health, including HIV prevention services. Fear of stigma and a related lack of privacy are major reasons why young people are reluctant to make use of public health services. These services do not always meet the needs of the young people. Although there are few youth-friendly clinics in Namibia that offer health services to young people in particular, they are not yet adequate and sometimes very hard to access. In addition, there are few opportunities for personal development among the youth in the communities where they live, with no safe spaces for them to have fun in a healthy way. It is important for young people to develop capacities and life skills in order for them to make a positive contribution to their communities, live a healthy lifestyle, and be better prepared for the future.
You can see in our Enana here, there's no well-known sport field, so maybe those companies can help us and introduce a sport field for us.
Consequently, without these opportunities, many young people fall prey to alcohol abuse. Teenage pregnancy and a very high rate of new HIV infections are also prevalent.
Due to the fact that there's no access to entertainment, they use that opportunity to go to the bars, smoke and drink alcohol.
Hence, the situation requires a comprehensive approach where different actors work together towards youth health development. The main objective is to make prevention, healthcare and empowerment a priority in young people's lives. In the Ohangwena region, steps have already been taken to turn the situation around. There has been a willingness to cooperate and share resources between the different ministries, institutions and organizations of the civil society and among young people themselves. This has been sufficient to greatly improve the situation for the young people of the region. Let's look at this innovative experience, which has been supported by GIZ and commissioned by the Federal Ministry of Economic Cooperation and Development. Since 2008, the multi-sectoral HIV and AIDS response program of GIZ and the Ministry of Health and Social Services have supported the implementation of the national HIV and AIDS strategies. To tackle a problem, one sometimes needs to take a different path. One approach to improve the situation has been to establish a youth health task force to achieve better cooperation between the different actors. The Ohangwena Youth Health Task Force follows successful principles of shared resources, better coordinated activities, and the creation of innovative events. In this task force, all the actors have come together to work on the interventions that cater for the needs of young people. Most importantly, young people have been made part of the process and their needs have been heard. Since its establishment in June 2014, the task force has managed to attract those that usually are most reluctant to use health services, namely young men.
What I strongly believe is that if the young men can be brought along and we design programs that fits their needs and actually also spread them to areas where they are so much excited. Maybe if we could look at a program that can also assist young men to be on board, even with male circumcision and other things, the rates are very low. So we have the potential to do better in terms of bringing the young men on board and to make sure that we are preventing HIV, because they are actually most of the masters when you are coming to sexual activities. They decide whether to use a condom or not, because the condoms that are available are more male-friendly than women-friendly. So on that basis, I think we can do better and have a better impact of inclusivity when it comes to the young men and HIV infection.
The task force established a working group that concentrated on getting more young men involved in sexual reproductive health and HIV prevention. A second working group was created to tackle the high number of teenage pregnancies in the region, which is currently over 22%. The task force realized the need to join forces to address this pressing issue. Since its inception, the task force has successfully organized testing days for couples, male testing days, a male conference, a teenage pregnancy awareness march, as well as outreach activities which included HIV testing and counseling at schools.
I came here to get tested so I know my status.
The reason why I get tested is because I want to know my status so that I will protect my partner and myself.
This regional initiative has received widespread attention from the Eastern and Southern African Ministerial Commitment on Comprehensive Sexuality Education and Sexual and Reproductive Health among Young People. This is also known as the ESA Commitment. 20 countries on the African continent have committed to make a change and to make good quality HIV and sexuality education and sexual and reproductive health services a reality for all young people. At the end of 2013, the Namibian Ministry of Health and Social Services and the Ministry of Education, Arts and Culture endorsed the agreement. The Ohangwena Youth Health Task Force is considered as a best practice for the implementation of the ESA commitment on a regional level.
Now, in terms of support that in the Ohangwena Education Directorate, Ministry of Health, Ministry of Education and Ministry of Youth received from GIZ partnership, that led to an initiative and a task force that was set up within Ohangwena Region, and it can be seen as a best practice. It's a task force where the three line ministries, Ministry of Health, Ministry of Education, Arts and Culture, and the Ministry of Youth, work together with key stakeholders, key development partners, civil society, and with the youth to basically coordinate and come up with activities where the youth are involved. The whole issue about the three ministries working together is also to pool resources, not just human resources, but I think it's high time that we need to realize that if we want to make a success of initiatives such as this, the ESA commitment, it needs to be integrated into our existing ministerial work plans. It's not something that stands alone, and that's the beauty of it. Ministry of Youth, Ministry of Education, Arts and Culture, when we plan, we budget.
But the youth approach in Ohangwena goes further than that. Young people thrive on entertainment and need alternatives to hanging around on the streets and in the bars. Resource mobilization to support youth activities has been a major problem in the region. Resources are scarce, so too are activities. Well, until recently, that is. Through dialogue and cooperation between relevant stakeholders, the Multipurpose Youth Resource Center in Enana now offers exciting new activities.
People are dying, people are dying. I don't understand why we shouldn't get this thing to see what we should do. Let's go. Let's get it to zero. Discrimination. Let's get it to zero. New infections. Let's get it to zero. Let's get it to Let's get it to zero.
In addition to all the new activities, young people also have the opportunity to receive youth-friendly health services at the Napa clinic next door. Linking fun activities with health services is the main objective of the collaboration between Napa and the Youth Center. One example of this approach is the support of youth dance clubs that receive training from the NGO Oyo, or the Ombecha Yahinga organization. Dance is a powerful means to encourage communication among young people about sensitive issues. The Enana and Ondobe youth clubs are examples of groups of young people who have succeeded in organizing themselves. Their shows tackle the problems young people face in their communities and usually performed in a humorous fashion. Yet the dangers of alcohol abuse and careless sexual relationships are also addressed through their dance performances. While touring the region, the two youth clubs have already reached an audience of over 24,000 learners.
We in the government are saying that the young people or the youth is the future of our nation. Now, to prepare our youth all for the future, as we are saying, there are few things to be done. The first one is actually to organize the youth, but we cannot organize them. They must organize themselves. It will be good if we can have offices, youth offices in all the regions, not only in Ohangwena, but in all the regions, where the youth people of the youth or the young people can come together, where they can express themselves, they can organize themselves properly.
Apart from dance and theatre, sport has the potential to support the personal development of young people and give them the space they need to gain important life skills. Using this approach, the Girls and Goals program of the Namibia Football Association, which is supported by UNICEF and GIZ amongst others, empowers young girls through football. The players also receive important information on sexual reproductive health, including HIV prevention and life skills. The program runs in 10 regions, including Ohangwena, and organizes many of its activities at the Youth Center. Other sporting activities used at the Youth Center to attract young people include basketball, boxing, and karate.
We are working with the Namibia Football Association, particularly with the women's desk, not desk, but women's department. Basically, one of the main objectives for the women's department is to encourage young girls starting from the ages of 11 up to 20 to participate in this program. The program only started in few regions, but so far we are almost in 9 communities. Enana was one of the biggest communities that recorded the largest number of participants. In one single day, we had over 600 kids participating, and I'm talking about girls participating. Thousands of girls playing each and every day. That should not hinder us. And that's why UNICEF, Girls and Goals, GIZ, we are sending our coaches, we are sending our experts to rural areas like this. This should not be an excuse for development.
Another milestone is better access and quality of educational programs and thorough sexuality education that involves young people in fun and engaging ways. The innovative approach by the NGO Staff for Life builds self-esteem and self-development. This approach has had a great impact so far. Staff for Life reaches out to young people in schools, but also targets out-of-school youths. The belief is that taking care of your body and health is not only a matter of knowledge, but also about important life skills like self-esteem and self-confidence. Young people are empowered to stand up for themselves and develop a positive perspective for their futures with their own hopes and dreams. In spite of its short existence, this experience has shown encouraging results. more young people are using the youth-friendly health services of NAPA. There has been a marked increase in the number of young people going for HIV testing and counseling, from around 400 in 2014 to 1,500 in 2015. The Ohangwena region has demonstrated that it does not need huge investments to make a change. Shared resources, joint strategies, commitment and the courage to try out new approaches makes it possible to create better opportunities for young people. However, as civil society organizations are dependent on external funding, additional resources need to be mobilized in order to ensure a sustainable implementation of this approach. By mobilizing national resources without relying on external donors, the ministries and organizations from civil society can ensure an ongoing implementation and continuation of its programs. This is how the diversity of and access to youth-friendly health services can be ensured. This approach is taking the youth one step further in establishing the fundamentals of their lives now and in the future. Together we shine for a healthy and self-determined life.
Since I've become a performer in this group, I've learned how to stand in front of the people. I never stand in front of the people before. But now I've learned from the group that I can do anything, anywhere I go, anytime. So I actually seen some changes. Even within my group members, they've tried. There are some changes that I'm seeing, and I know it's working.
Since I started this Girls and Goals program, I have changed my behaviors since I taught us how to behave well to other people, not to behave so rude, and it also gave us confidence. Like if we have boys, we could say no to have sex with them.
It's free, that's me. It's free, that's me. It's free, that's me. It's free, that's me. Say